The new battle over health care begins. Joining us on Columbus on the Record this week, Kathy Kandinsky, State House reporter for the Columbus Dispatch, Mark Niquette, reporter for Bloomberg News, Derek Clay, Democratic strategist, and Mike Miller, former Franklin County prosecutor. Ohio seems to be at the center of the debate over what to do with Obamacare. Nearly 1 million Ohioans get their health insurance through elements of Obamacare. But Republicans this week presented a plan to scrap much of the Affordable Care Act. The plan would eliminate the health insurance mandate. It would replace subsidies with tax credits. It would end the current Medicaid expansion, but it would keep provisions protecting those with pre-existing conditions, and younger adults would be able to stay on their parents' plans until age 26. Democrats universally do not like it, but Republicans are split. One Ohio GOP congressman calls it an Obamacare replacement. Another calls it Obamacare in a different form.
It's patient-centered. It takes power out of this city and sends it back to patients. We've been campaigning on a patient-centered, focused health care bill, which this is the beginning of, that puts patients in charge of their health care.
The first thing Republicans are bringing forward is a piece of legislation that we're going to put on a Republican president's desk that says we repeal it, but keeps Medicaid expansion and actually expands it, that keeps some of the tax increases. That is not what we promised the American people we were going to do.
Kathy Kandinsky, this is like deja vu in reverse. Yeah. When Obamacare passed, the Republicans were united in their opposition to it, but the Democrats were divided. Now with this plan, it seems like Democrats are united in opposition, but the Republicans are divided.
Right. Well, I think it's very telling that nobody wants their name on this plan. Nobody wants it to be Trump Care or you know, Ryan Care or anything like that. But the problem is pretty simple. There's people in Congress that wanted the total repeal of Obamacare, and they see things like tax credits, which would replace subsidies under this proposal, as just another entitlement program. So they don't think it goes far enough. Then there's others, like Senator Portman's been vocal about this, Governor Kasich's been vocal about this. In states where we've had Medicaid expansion, the bill would do away with Medicaid expansion after 2020 at this point, although there's some talk about doing it sooner. That would affect hundreds of thousands of people in Ohio. So that's pretty much where you're divided.
So Mark, where does it go from here? It's passed a couple committees, so it's moving along, but the full House vote and full Senate votes are still to come.
Right, and there's been already some talk in the Senate among senators that this doesn't have enough support right now as it's written to get through the Senate. So even if it passes the House, it might have a tougher sell there. It's going to be interesting how they actually amend this bill, because it seems like the bill as introduced just doesn't have enough support, or at least put it this way, there's enough opposition to scuttle it. You have the AARP who's come out against it because of the fact that older people would probably pay more under this because of the way the subsidies work. You have hospitals come out against this. And this is a big deal, I think, particularly in a state like Ohio, because the Medicaid expansion meant a big deal for hospitals in terms of giving them funding or avoiding some of the uncompensated care they had to pay for with folks who would show up at the emergency room and didn't have insurance. And the Ohio Hospital Association has estimated that if the bill as presented is enacted, maybe 25% of Ohio hospitals could close because the margins are that close.
Mike, I don't know where you stood on Obamacare, but is this a better plan than the Affordable Care Act?
Honestly, Mike, I don't think I understand either one of them that well. I do know this, the Republicans have a huge political problem, as Kathy pointed out. The conservative wing of the House, anyway, seems to be led by Jordan, totally opposed to this thing. But I know one thing, at least I believe one thing, and that is that President Trump is going to be a figure in this thing. If he thought enough of the Ohio Republican race to call people there to try and take Matt Borges's job, which he ultimately was successful.
Former chairman of the state party, yeah.
Former chairman of the state party, and he called the people there. When it gets to this bill, the Trump Care or whatever you want to call it, he'll be calling the Jim Jordans of the conservative right and putting a lot of pressure on them. And I suspect some of them will fold. Now, whether it's enough, I don't know. And even if he gets through the House, as Mark says, it may well not get through the Senate. So it's a tough sell. There's no question about it.
Derek, the Democrats are on the opposite side now. They're pretty united in wanting to keep the Affordable Care Act.
Right. I think the biggest takeaway that we can take from this is that the GOP is just not unified. We saw that there's major breaks in their party on the proposed health care plan. You know, the Affordable Care Act, which was called Obamacare, had its, you know, it had some problems, but I don't think that they were problems that we could not overcome in time. And you know, the Medicaid portion of this of what the GOP wants to do with this new health care plan is not flying well with a lot of Ohioans, including our governor, because the people that depend on it is going to take care away from them.
One of the things you don't see in this plan that a lot of people have been clamoring for is what does it do to control healthcare costs? What does it do to reduce healthcare costs? And that's what's really kind of absent. That was absent in Obamacare. It's absent in this plan. It's something that they still have not seemed to be able to tackle.
Mark, Pat Tiberi, the congressman, said that this is a patient-centered bill. It puts patients in charge. And of course, there was criticism the Obama administration oversold the fact that you could keep your doctor. But we've never been able to keep our doctors under the current modern plans, because if you change jobs, you go to a new plan, you got to find new doctors. Are patients really in charge? Are they ever in charge?
Yeah, I'm still trying to figure out actually what that phrase means, because you hear it as part of the talking points now, patient-centered plan. And I think the idea they're trying to get across is it's less government-focused, or at least there's fewer mandates on individuals or giving individuals more choice. But you know, the fundamental problem with the whole healthcare debate is really, you know, what we saw with the fight over the mandate, because the idea is if you don't have healthy people paying into the plans that, you know, distributes the risk pool, you know, economically it just doesn't work, which is why, you know, it was sort of a Republican idea once upon a time to have some kind of mandate to get everybody involved in the system, which is the only way to sort of control the costs and make it work.
Mike, what are your thoughts on the subsidies, whether they're called subsidies or tax credits? They're basically it's government payments to help some people buy health insurance.
Well, I saw the initial one with the Republicans, if I remember the numbers right, gave credits up to people making $150,000, married couples, I think, which seems unnecessary. I think people who make that kind of money don't need that sort of a thing. Whether there's any real difference in how they call it, whether it's tax credits or premiums or what have you, I think it makes a great deal of difference. But I just think they're trying to do too much. People that make that sort of an income, I don't think need any government subsidies.
But for lower income folks, you don't have a problem with the government chipping in a little bit of money? Or
not at all. Not at all.
Derek, this applies to such a few number of Americans in the big picture. There's a lot of Americans. I mean, there's like 22 million people now have insurance that didn't. But I mean, there's 350 million Americans. I mean, this is a small slice of the healthcare market. Does it get too much attention? What Obamacare does through expansion of Medicaid and the private exchange. Most of us get our insurance through our employer.
Well, this is what I know. We pay taxes. We pay taxes into a system that's supposed to give us something in return for our taxes. And a country of this size that has this much wealth, our priorities are just not in the right place. So if you reprioritize some of the things that the United States wants to do in terms of, you know, military spending, which we spend more on our military than all of NATO combined and a lot of different countries around the world combined, you can fund a healthcare system that is manageable so that all people can have healthcare in this country.
You know, I would just point out, it really does affect more people than just the folks that are in the program, because as Mark pointed out earlier, when we have large numbers of uninsured people, those healthcare costs, when those people get sick, they get cared for. They usually get cared for in emergency rooms, which are really expensive. The hospitals don't just absorb those costs get passed on. So it really affects more people than just the folks that are in the program.
Okay. We have another official candidate for governor. Former Congresswoman Betty Sutton is the second Democrat to join the race. The labor lawyer from Northeast Ohio served 8 years in the state legislature and 3 terms in Congress. Sutton joins State Senate Minority Leader Joe Schiavone as the only announced Democrats in the race. Of course, 3 big-name Republicans stand ready to enter the race as well. Derek Clay, is Betty Sutton where does she rank in the rankings of announced candidates, Democratic candidates for governor, and the ones that we expect to get in? Where does she rank on that ladder?
Well, in terms of ranking, I mean, we really don't know. I mean, there's only 2 announced candidates, as you mentioned, Joe Schiavone, who's our Senate Minority Leader, and Betty Sutton. You know, there's other candidates out there right now that are thinking about it. When you think about Nan Whaley, mayor of Dayton, when you think about Jay Williams, the former mayor of Youngstown, who's thinking about entering the race, I mean, there's a lot of unknowns at this point. So, you know, she's well known in Northeast Ohio because she was a congressperson up there, and then just recently she was executive director of the St. Lawrence Seaway Corporation. But, you know, in terms of a ranking, I mean, it's really too early to tell.
But she's a pretty strong candidate, right? I mean, she's got good name recognition, and we're in a part of the state where Democrats have to turn out. Mark.
Yeah, and she lost her seat in Congress because essentially with after redistricting, she was put in the same district as Jim Renacci, the congressman in that part of the state, and it was actually one of only 2 races in the country that year that pitted incumbents in the same race, and she lost. So she does have some attraction there. I think a lot of people are sort of waiting to see how the field's going to shake out with regard to what happens with Richard Cordray. You know, he's head of the Consumer Financial Protection Bureau, and there's some thought that he might be interested in running for governor, but his position there is a bit tenuous. He's still running that agency, but there's a big push by Republicans in Congress to try and fire him, essentially, which would obviously free him up to come here and run for governor if he wants to. But it's unclear about the timing of what's going to happen with his position, if he'll stay in Washington or even be available to run.
And that's with health care, that's pretty much on the back burner right now, at least until this gets settled, probably, the Financial Protection Bureau. Mike Miller, is Betty Sutton, is she someone that Republicans fear as a possible finalist?
Well, I don't think so, Mike. It's so early. We talk about Betty Sutton, who I don't know. I'm sure she's a very nice person, but this well-known and so forth, I don't accept that either. I think congressmen are basically known to their constituency, and you get outside the state, people will not know who she is, or outside her district in the state. Now, that can be overcome very quickly once the primary starts or whatever they have, and campaigning. But I don't think there's any fear there, but I don't know the Republican candidate's going to be. There's a lot of people in line for that, and we've got a long, long time before that election, 21 months or something like that?
11 months until they actually officially file to run.
Right.
At least the deadline to file to run.
So there'll be a lot of shakeout. I imagine there'll be, as Derek says, many more Democrats are going to be interested in it, and I know, as we all know right now, 3 or 4 Republicans that said they're in.
Mike DeWine, John Husted, Mary Taylor are the big names. Jim Renacci also, as Mark mentioned.
They all have a lot more name recognition right now.
Do they all run,
Democrats.
or some pick another office?
No, I think they'll figure. I think it'll sort itself out a little bit. We may still have a primary. I expect we'll have a primary, but I don't think it'll be a 4-way race.
Who will definitely be in the primary? Would you guess? Mike DeWine?
Are we allowed to guess? Okay.
Sure.
I would.
You can make an educated and analytical guess.
I would see DeWine and Husted as the front runners right now. That would be my educated guess.
Mary Taylor would probably run as well.
You think? I see. I kind of suspect she might go find something else. Maybe not.
It'll be interesting. I mean, it all comes down to Donald Trump, how popular he is, whoever.
Well,
that's what people look at.
If I'm the president, I want Richard Cordray to stay in Washington as long as possible, so that gives the GOP candidates a little more traction. You know, I think if Richard Cordray was able to, if he was fired and came back, then I think that raises or changes the game for a lot of the GOP candidates. You know, Nan Whaley, again, she's another one that she hasn't announced yet, but I know that she's really working hard behind the scenes, going to visit some folks, and she could be a viable candidate as well. So we'll see.
We're not hearing P.G. Sittenfeld's name anywhere. He's not going to try again after a decent race for Senate. I mean, he lost in the primary, unknown.
I mentioned that to Derek when we were sitting waiting to come in here, Mike, that I thought he would be somebody who would be a candidate. Whether he's still too young, I don't know. But I know he got beat pretty good in the Democrat primary, but I thought he made a good impression.
He'll be back.
We'll see.
Well, and this is part of the dance that goes on too, where there's talk about who's running for governor, but then it's also part of who's going to run for the you know, the
Everything.
down ticket
General
races
auditor
and
and-
who gets slotted where.
And if I could make one more comment, I think the key is going to be early on who of these candidates is going to raise enough money
Absolutely.
to actually put themselves out there, raise their name profile, and be able to make themselves known to the people of Ohio.
Right. Absolutely.
Our next topic, small communities and large communities in Ohio continue to struggle with the opioid drug crisis. They are trying just about everything to curb the use of prescription painkillers and heroin, which lead to deadly overdoses every day. The small community of Washington Courthouse is taking a unique approach. It has started charging overdose victims with a crime, inducing panic. Police officials say it'll hold users accountable and get them help if they want it. Other cities say charging users with crimes leads to more deaths because they won't call for help when there's an overdose. Mike Miller, you've been both a prosecutor and a defense attorney. Is it a good idea to charge victims of an overdose with a crime? They are doing something illegal, but they obviously need help.
Well, Mike, you have a difference of opinion. Obviously, Washington Courthouse thinks they should. Franklin County has done completely different. I talked to Ron O'Brien very recently about this, and he told me the coroner estimated from January 15 through July of 16, there were 440 overdose deaths in Franklin County.
It's like 3 a day or something like that. Yeah.
Well, it wasn't quite that high, but I believe the mayor in the last few days has said we're averaging 2 a day in just Columbus, as opposed to Franklin County. Big problem, but there's a lot out there that can help, and the coroner has a program locally. There's drug courts. I mean, there's all kind of help for these people. What I really was interested in was something the sheriff has been doing, and whenever they have an overdose, and I think that's when they use the Narcone or the prescription, they send somebody out there, and they have healthcare people with it. And once the person is resuscitated, if that's the right word, they get them to promise to make an appointment and actually go to a healthcare place. No arrests, no charges, no nothing. And Ron tells me that the percentage of people who've actually done it is 61%. Now, you would think, gee, you just were about to lose your life, you would think it would be 100%, but we all know the world doesn't work that way. So I think 61% is pretty good. Now, how they follow up after that, I don't know. But the problem is so staggering. I think in the last few years in the country, we've lost more people through drug overdoses than we did in the Vietnam War.
So, what do you think of the Washington Courthouse program? Marion, for instance, they stopped doing this because when they were charging overdose victims, more people were dying because people were not calling to say, my buddy just overdosed, because they're afraid they get arrested.
Right. First off, I think that the drug companies can do a little more in terms of public awareness about the situation. You know, no one ever wants to get arrested. I mean, you're already battling drug addiction, and then you get arrested. You know, during the crack cocaine epidemic, I mean, people were just going to jail. I mean, and they were going to jail for long periods of time. So, you know, the misdemeanor, although it's not, although you don't want to be in that situation, you know, it might save some lives.
Yeah. But Kathy,
Ultimately, it's a disease.
Yeah.
You know, ultimately, opiate addiction is a disease. So I'm not really sure charging people is really going to help people. What's going to help people is getting people into treatment. So the question becomes, what's the best way to get people into treatment? Is it charging people and throwing them in jail for the night, or is it getting them into drug courts? Is it getting them into treatment programs? The biggest complaint I hear from folks that advocate for the drug addicts is that there's not enough treatment beds. So that somebody might decide, and you know how this is, one minute you want your next fix, the next minute you decide you want to get clean. So when that happens, you got to have some place to go, like right now.
Yeah.
And that's the problem that I'm hearing from folks on the street.
And there's I think a pretty clean link too between the problem with opioids and drug addiction and the fight we're having right now over replacing the ACA, the Affordable Care Act, because I think it's pretty clear that one of the features of Medicaid expansion was that folks who did have substance abuse problems were getting treatment under the expansion that they maybe otherwise wouldn't have gotten. In fact, that's one of the things that Governor Kasich in particular talked a lot about when he tried to defend Medicaid expansion, that it was getting treatment to folks who had mental health or substance abuse problems who might end up in prisons if they didn't get treatment. I've seen statistics that as many as 42% of the folks in Ohio who got Medicaid expansion had some kind of substance abuse or mental health issue. So I think you'll see a lot of the debate about, how much does opioid addiction and drug abuse problems factor into, do we get coverage for these folks?
Picking up Derek, on your call for drug companies to get more involved, this reminds me a lot of the tobacco issue. I mean, the states went after big tobacco when it became obvious that they were having to spend a lot of money on health care to treat tobacco-related illnesses. A city in Washington state has now just sued a pharmaceutical company for overprescribing opioids. Do you see a big tobacco type fight coming here with big pharma over this?
I don't know if there's a fight. I know that all major companies, including drug companies, have marketing dollars. And, you could take some of those marketing dollars to do public service awareness about, how to use drugs responsibly when you prescribe drugs. So that's one way that I think that some of the big companies or the big pharmaceutical companies could assist in this fight. This epidemic became really real for me just maybe a month ago. I was down in Cincinnati and stayed the night, and I was at a hotel room and went downstairs to get something to eat, and the police were there, and some guy down the hall had overdosed.
Wow.
And luckily he didn't pass away, but still, I mean, that's when it became really real for me that this is like a super huge
picking
issue.
up on your point on the drug companies are also the ones that are selling the medicated assisted treatment that people, the Narcan that they're giving to folks when they overdose, and all the other medicated assisted treatment that they use to kind of help people kick their habits.
Okay. Let's get to our final topic. With each passing election, each passing year, even each passing news event, the political divide in the country seems to grow. In poll after poll, there seems to be no issue on which Democrats and Republicans agree. Gerrymandering has created highly partisan liberal or conservative districts, which has hardened partisanship in Congress. New presidents take office and immediately face protests and united opposition. Mark Niquette, these maps that we're seeing that show how divided we are, what is the root cause at this point? Is it gerrymandering? Is that the cause, or is that the symptom?
I think gerrymandering contributes to the problem, and clearly you're seeing continued sort of breaks along ideological lines, folks who identify as Democrat or Republican and vote that way. But I think part of what's going on too is you're seeing changes in the divisions more along class lines or by race or economic status. David Brooks from the New York Times had an interesting column today where he talked about how the fight over the Affordable Care Act might be the point where the old order of American politics cracks up, because you had Democrats, the old guard, pushing universal health care. That spawned the Tea Party and the folks who wanted limited government. But the bigger force at play was sort of the folks who felt like the system, political system and the status quo had left them behind, that either Democrats or Republicans were speaking to them, and it sort of helped get Donald Trump elected. And the idea was maybe this fight over health care really leaves both the old guard Democrat and Republican parties without a place to go.
Mike, can you compare this to any you're a historian, any point in history? Have we gone through this before as a country?
Mike, I've never seen anything, certainly in my lifetime, and as a country, I don't know that we have. I can't speak about the Civil War and how things were then.
Yeah, that was pretty bad.
I know they were heated, and how they felt about each other. But this thing, when I look at people like Trump and the way he talks about things, and I look on the other side, I look at people like Elizabeth Warren and how she talks about things, and I have not a lot of hope we're going to get down and get cooler heads actually sitting talking. I'm not sure anybody wants to.
You have Kasich right now calling for bipartisan talks to get a health care solution. Nobody's paying any attention to that. Nobody cares. I mean, that seems like the most common sense approach to me.
But you can't go home, Derek, to your district and say you compromise with Democrats if you're a Republican, and likewise a Democrat compromise with a Republican.
Right. When you look at the legislature now, I mean, just here in Ohio, you have, if you look at the Senate, you got 9 Democrats that represent districts throughout Ohio. Yeah. And of those 9, so you got 33 Senate districts, 9 are Democrat, and they represent 8 of the 10 poorest districts in the state.
All right, let's get to our off-the-record comments pretty quickly. Start with you, Mike Miller.
In the conversation we had before we came in here, Mike, again, I was told by, I think, Kathy, that Arnold Schwarzenegger may be running for U.S. Senate from California against Dianne Feinstein. And if that happens, he'll lose.
Derek.
I was in a meeting yesterday, and you may have talked about this on another previous show, about the Hyperloop, where you can go from Pittsburgh to Chicago in like 10 minutes, which is crazy.
Next week?
Hyperlink.
All right,
Yeah.
Mark.
Actually, on the Hyperloop, there was a big meeting on infrastructure at the White House on Wednesday where Elon Musk, who's pushing that project, was there, and the president apparently asked about that project, so look for that in the infrastructure
And
plan.
Kathy.
Regardless of what happens in Washington, I think you're going to see a real push to cut back Medicaid costs here in Ohio, because in the hearings this week, we found out that the governor's proposal is a 4.29% increase, and this law caps it at 3.3. A lot of lawmakers were concerned about that one and know why.
All right. Ohio State this week moved to copyright the oval. I predict, and it was after copyrighting the shoe. I predict next they will try to copyright the or the. That'll be the next thing they try to copyright. That's Columbus on the Record for this week. Check us out online, Facebook, Twitter, and our website, wosu.org/COTR. I'm Mike Thompson. Have a good week.